Amir Jamali, hip surgeon, asking a simple question. Amir, every surgeon trains. Every surgeon does what's called a residency after graduating from medical school. And some surgeons go beyond the residency into what's called a fellowship. You didn't do a fellowship, you did two fellowships. So the question is, what's the point of a fellowship and why would you want two of them?
Well, in my case, I trained in San Diego where there was a tremendous interest in preservation of the joints. And I also had a wonderful professor who really got me interested in joint replacement. So I did want to understand how joint replacements could be done in a very, very excellent way. And also, if you need to do a revision or redo of a joint replacement, feel very comfortable doing those. After I had done my fellowship, I worked for a year, but I still had a hunger to learn more about preserving joints. And that led me to do the second fellowship, which was in Switzerland, which was specifically on hip preservation. Essentially, how can we get joints, the hip specifically, to be remodeled? How can we resculpt the joint to get it to last longer so that it doesn't necessarily need a joint replacement down the road? And that's what led me to the second fellowship. In general terms, the question of why to do fellowships, I think people are really expecting a certain level of expertise these days. And many generalists are no longer even able to find positions in bigger cities or in more competitive markets. So many people now, over 70 to 80% of graduates are now doing fellowships, if not higher.
So you're making an argument that fellowships are important from the surgeon's perspective. What I'm trying to get at, though, is what difference it makes to a patient. I'll give you a couple of related questions. One is, you're doing a procedure now, arthroscopy, that you didn't learn in your fellowship or in your residency. And so the fellowship really matter. I mean, here you are doing this new thing just because you're innovative and you're interested and you're, I guess, a lifelong learner. And here's a more patient-centric question. Look, one of the surgeons we have for joint replacement is not fellowship trained. He's actually a family physician who decides to become an orthopedic surgeon. Unusual, but he did an orthopedic residency. And the recommendations we have on this guy are just phenomenal, stellar. I mean, the OR nurses, the anesthesiologists, his peer surgeons, the administrators in that environment, they all send their friends and family to him. He's not fellowship trained. So the question is, which are the variables that help a patient understand if a surgeon is good, if the surgeon is good enough to operate on them? It would appear that the fellowship is certainly not the be-all and end-all of the answer to that.
Right. I think the fellowship is a very quick and efficient way to gain a large amount of experience in a short amount of time. So the surgeon that you're referring to, for example, may have been doing a number of joint replacements over years at a moderate volume or even at a high volume.
Yeah.
And if that person is interested enough to go and do courses and spend time at meetings and also have a high volume, I think they could clearly achieve the same level of expertise as someone who has done a fellowship. The fellowship in some ways is a checkbox that indicates that you have worked as an apprentice under someone who is an expert in the field and in a relatively short period of time, usually a year, gained a fair amount of experience. But still, if you're out in the real world doing those cases at a high volume and also are up to date on the literature, I think you can achieve very similar, if not better, results on your own. As far as hip arthroscopy, when I started doing that surgery, there really were no fellowships that were providing a high volume of the techniques that were evolving in real time at the time. Now, I envy the people that are training because all of that has been developed and it's basically given to them in a very quick way, rather than in the old days when we had to apply techniques from open surgery to arthroscopy, and it was much more challenging, but in some ways more exciting also to be on the cutting edge. So fellowships are now in hip arthroscopy being done, but they weren't even available in the current form 8 or 9 years ago.
I guess what we're coming to is fellowships are really a great way to hone your skills after your basic training, but medical technology evolves, and if you want to stay with it, you got to keep learning with or without the fellowship. So with that, I will say thank you, and we will talk again soon.